What inspired you to go into medical industry?
It's a very long story. Actually, my journey started 23 years ago when I graduated from the university and changed those people's lives. Because the earlier you prevent and diagnose the option, the disease, the more you can control. So I thought it's better to dedicate my mission. And I think it was a great mission to work for. That I wanted to work for saving those people's life. Because really, education and diagnosis and prevention can make a great impact on those people's lives. So this is why I love to work for Diabetic Food.
Welcome to Vic Influential Podcast, where we bring you conversations with industry leaders and innovators who are transforming lives and shaping the future. Today, we have an extraordinary guest, Dr. Ahmed Elawadi, the CEO of Rothana, a company recognized by its groundbreaking solutions in diabetic food care and wound management. With over 23 years, Dr. Ahmed has worked with the leading companies like Johnson & Johnson and 3M before starting his own entrepreneurial journey, and also ranked at top 5 among the creators for aging and longevity in the UAE and top 10 creators for diabetes and diabetic care worldwide and on LinkedIn, and top 20 CEOs and leaders on social media platforms across the UAE on LinkedIn. Dr. Ahmed, it's an honor to have you on Vic Influential Podcast.
Thank you, Victor. It's a pleasure to be here with you today.
Yeah.
And thank you for the amazing introduction. I'm very excited really today to be here with you and share my insights and idea. I hope this podcast will add value to people's lives.
Yes.
Also creating an impact, whether it's for health, for business, or for personal growth.
Yes.
And also, I would like to thank you for making this podcast. I think it's a great way to share ideas, thoughts, and also we might inspire others to change and make positive impact in their lives.
Yeah, that is the aim.
Yeah, thank you very much. Thank you.
So I want to ask you to start in, what inspired you to go into medical industry, particularly on diabetic food care and wound management?
Yeah, it's a very long story. Actually, my journey started 23 years ago when I graduated from the university. And I have the passion to work for industry, medical and pharmaceutical industry.
Yes.
You know, you understand, either you are selling medical or pharmaceutical product, you are saving lives of people or treating diseases. At the end, it's a great mission to have.
Yes.
If we go back to the diabetic food, actually, it started at the time I have joined Johnson & Johnson wound care department. And it's the first hand when I go and see those patients. And how they suffer, amputation, some of them losing their lives. And I have seen how education can make a big impact and change those people's lives. Because the earlier you prevent and diagnose the option, the disease, the more you can control. So I thought it's better to dedicate my mission. And I think it was a great mission to work for. That I wanted to work for saving those people's life. Because really, education and diagnosis and prevention can make a great impact on those people's lives. So this is why I love to work for Diabetic Food.
Yeah. You know, when I cannot imagine myself losing one of my arm or even one of my foot. So amputation, I think, is one of the crazy things people will always go through in life. They can see their self without hand. I don't think I can imagine myself living that way. But some people go through this thing because it's life, and this is what people go through. So I want to ask you, starting your company, Rothana, what is the biggest challenge you faced, and what did you learn from it?
You know, life is full of challenge also. And, you know, challenges always I classify into two parts: personal challenge and a business challenge. If you come to personal challenge, it was very hard for me to change my job because I've actually decided to establish Rothana. At the time, I have a very great impact on my personality, my psychology, because I have faced a very hard moment working in a company. It was a big company actually, but unfortunately, I was managed by one of the worst managers I ever see. The guy have impacted me negatively a lot in my life and in my business life also. But actually, this was the moment I have decided to stand here and decide to change my life. So the most important when you face challenge in your life is how you can react to this challenge. Some people lose hope, some people become demotivated, but at this time it stand, and actually I have to admit that I have been raised in a way which can stand against problem and troubles. My father was a officer in the army, and like I can say he raised me up like a soldier, so I can stand in all hard times. I know what to do in when it comes in very bad situations.
Yeah.
And this actually impacted me a lot at this moment when I have a great stress. And I have to also say about something very important in your life: the family support. You always should be surrounded by people who support you in your life. My wife stand behind my back when I have this very negative impact from the bad management, negative environment around me. I decided to establish Rothana, which is a very hard decision. I was just 33 years old, just for information, very young. And she said, I believe in you. Go and do whatever you want, which was a very big turning point in my life. And this is now we have seen the success we are in now because we know what to do in the moments of hard times. Actually, also I would say another story which is very important because when you started a new company at young age, you don't have any experience running a company before. 33 years old person, and he is coming from a negative impact of very bad environment, and at the end he's shifting all his life, leaving a permanent job to open a company. And at this time, I have chosen one of the product. It was actually from my point of view, it was amazing product, but I have looked to the product from the end user point of view, not an investor point of view. And this is very important because I never run a company before. I was very young. I don't have any information about how can I choose a product or how can I run a business from A to Z. But even at that point, after keep spending money for like around, I can say 6 to 8 months, we have lost all our money and resources, and we didn't get any success because unfortunately the people in the market doesn't like the product. So at that stage, I take a breath. I decided to look to my strategies, start from zero again, and take the right actions. And always in my life, and I believe in everybody's life, challenges is what shape you. And we have decided to go to make the right strategy, choosing the right product, target the right market, and then we have started again. And actually, this was one of the very biggest challenges in my life.
Mm-hmm.
It was a very hard moment, I have to admit.
Some managers don't realize how they treat their employees, the effect it has on their psychology. Some I have witnessed some myself here in UAE. I have witnessed some, and most times they think that they want to motivate you, they want to breed you into soldier. That is why they treat you the way they treat you. Some think that is a real way to teach their employees, which is crazy. Some don't recover from it. If a manager is having so many resignations under him, I think that manager should try to think, what am I doing? But most don't think it is their fault. It's always the employee's fault. Most times it's the employee's fault, yes. Some employees are they just come in to waste time and go. But I think most managers should self-reflect. This is my own opinion. I think that any manager that is having mass resignation under him should self-reflect. So my next question we go is, diabetic foot wound is a major concern in healthcare industry. So I want to ask, what is Rothana doing to change lives? What is Rothana doing that is different from other company, and what is they doing particularly to save a patient's life?
Actually, this is very important question actually. And before I answer what we are doing in Rothana, I think we should talk about the diabetic foot complication itself.
Yeah.
And I don't want to go in numbers and statistics, but we have to understand what is the impact of diabetic foot on patient life. I just want to tell you something. Every 20 seconds, somebody is losing limb because of diabetic foot. You imagine 20 seconds.
Every 20 seconds?
Every 20 seconds.
Like right now?
Yes. That we are talking now, maybe in our podcast, maybe
Somebody
how many
somewhere.
patients will lose their feet. So you understand, the numbers are very shocking. And not only that 40 to 50% of those patients who lose their limbs, like within 5 years, they will die. So it's not about diabetic foot only. It's like not a simple disease. It's one of the complications of diabetes, which lead to bad quality of life because immobility, you cannot move anymore after your amputation, bad quality of life. And then even people will lose their lives within 4 to 5 years. So this is a very, very important point we have to start from. And we have to understand, and from the experience we have in this category of complications on this sector of business, that education, diagnosis, prevention, and treatments can change how the numbers will be given. So in Rothana, we have decided to invest our time, our money, and also our experience into creating solutions. So we are not selling product. I don't want to say that Rothana are selling product. We are creating solutions to diagnose, like different tools. You can make diagnosis for diabetic foot. You can prevent diabetic foot by proper footwear, insoles, offloading devices, and you can also treat wounds with different type of wound dressings, new technology product like biological product, and I think the AI will have a great impact into this. So at Rothana, we are not treating disease. We are giving a solutions to save people's life. And actually, I always, over all my social media, over all our product catalogs, and the education program we are giving everywhere to communities and to healthcare providers, we are not always talking about product. We're always talking about solutions. We call it 360 solutions. How we can diagnose, prevent, and treat diabetic foot. This is what Rothana is doing.
Yeah. So they are putting in their resources, their time, and also training to improve
yes,
the early intervention to make sure that patients will. But if during the early intervention you can manage the wound so that that part of the leg don't need to be cut away.
yes.
So it's achievable.
But why we will go to even wounds? We wanted to prevent the wound from happening.
Yeah.
We don't want to go to the wounds. We wanted to educate patient about like proper footwear, how can the diet, exercise, lifestyle.
Yeah.
Why we don't want to treat wounds. We want to stop wounds from happening. We want to prevent diabetic foot ulcer. So if you work before in early stages, you could also prevent diabetic foot. So we always putting our resources and our training programs into educating both patients, community, and healthcare provider, how we can reduce the incidence of diabetic foot ulcers. It's not only treating the wounds. So we should work before that.
The sensitization of try to educating people, has there been any complications? Like, is it going well or?
Okay, I will tell you something. The education is a simple thing because you can. It's like there's an education program. It's like we can go to talk to the healthcare provider. But the problem here is that patient might not follow the instructions.
Yes.
You tell them you have to wear proper footwear. He will wear like open shoes or maybe tight shoes, and this will be affecting it will be the result of the complications. So the more important than a training program, that we have to show those patients what is the impact of their quality of life, or even the life itself, if they don't follow this educational program. I think this is more important than the education program. Patients have to feel the fear and the impact if he do not make the early prevention of and make following the instruction, or making like a diet, exercise, which is a healthy lifestyle. So healthy lifestyle is very important in those patients. If we could show the patient, and the patient have understand what is the impact of these simple instruction to their future life, they might lose their limbs. They might also have, it will be a risk on their lives. They might lose their lives. So I think they will start as much as they can to do their best to follow the guidelines, and also to comply with the education. And like, it's simple. I'm just telling you, do some exercise. Your food should be controlled. Your blood sugar shouldn't be high. I don't think this is something very hard to tell patient about. So simple things can make big changes in your life.
You know, if person have not had any personal experience, or somebody in the family going through this, and it will look like it's just a long story. Yeah, but if it's becoming a long story, maybe someone should just do a basic research about diabetic food care to understand, if they really do not understand what we're talking about on this podcast, right? That's a good way to go about it.
I agree.
Yeah, and another thing I'm asking, and I want to talk about it too, is when you tell somebody that there is something like a longevity and expanding lifespan, it looks like how can we expand our lifespan when there is something called fate. When it's time, it's time. There is nothing you can do to expand lifespan. So can you tell me what is Rothana doing, and the role Rothana is playing in longevity, and expanding lifespan?
Okay, longevity actually, yeah, like people might like have some conflict related. What is the meaning of longevity? Some people will not believe that you can extend your life.
Yes.
But let me say it from my own perspective. I believe longevity is not only increasing life. It's not about lifespan. It's adding the quality of life, your existing life.
Okay.
So I wanted to add quality years of the years, not the quantity of the years.
Okay. Sorry. Can you explain what you mean?
Okay.
By,
I'm in my point of view.
Yeah.
Longevity is not about extending your lifespan. It's about health.
Okay.
Or let's say it in simple way for people who are watching us, that we wanted to add more quality of years to your life, not increasing number of years.
Okay.
So I prefer to look at it from this perspective, because you have to understand that what if I live 100 years and like 20-30 with a disease? What is it? I don't think life will be very good in that case.
Yes,
so if I put in your life more better quality healthy years, rather than putting more years, I think you'll enjoy life. So it's, I don't want to make limitation of the what is meaning by longevity here, but because at the end it is health span, not lifespan. This is what I believe. And actually, why we in Rothana we have been interested into longevity, because I will tell you something. Diabetes itself as a disease is one of the diseases which affect 800 million persons worldwide nowadays. So it's very important to understand that diabetes is also affecting longevity. It's affecting our health, affecting our because it's not only giving you bad quality of life.
Yeah.
It's also could be the reason of why you die. You might lose your life because of the complication of diabetes and diabetic food. So we have understand at that point that what we are doing in Rothana in terms of prevention, diagnosis, and treatment is a part of longevity also. Because at the end, we are working to improve quality of life of people, adding more quality of years, not quantity. And that was the same aim or the same mission which longevity is working for.
Yeah.
So We understand, and at that point that our education program, because we talk about what exercise. Exercise is part of longevity, by the way.
Yes, yes.
Food and diet, it's part of longevity. Healthy lifestyle, this is part of longevity. So at the end, the education we are doing to the patient is adding value to them to help them to have more quality of life.
Yeah.
And quality of life is part of longevity. So at the end, education, diagnosis, prevention, and treatments, which I just talk about it now in the last previous questions, it's about of longevity. This is why we were interested into being a part of this mission worldwide, that we wanted to not only to improve the quality of life, to add a value in longevity, which in my opinion, it's better to explain it as living more healthier, not more longer. And in the same time, it will also prevent diabetic foot ulcer, preventing complication of diabetes, and saving lives. So all of them are coming under the same umbrella. Longevity, diabetic foot complication, or prevention of diabetic foot complication is the same.
Yeah, tackling diabetic foot at the early age is a part of longevity.
Yes.
Because when you realize that you're having this, does it have symptoms?
Yeah, actually, diabetic foot complication is starting that people start to lose sensation in their feet, like toes. And this is the initial stage of complication happen. After that, it will come to like maybe foot deformity. It means your bone will start to change, and then at the end you will have a pressure when you walk, because this changes in the shape of the bone of the feet. You have pressure, and with a improper footwear, which is very important in such cases, the ulcer pressure will happen in your feet, and then the ulcer will happen. You know, if the ulcer happen, that you started the way.
And you are providing devices like a shoe for people to wear.
But as I said before, the subject is not only limited to the shoes.
Okay.
It's limited to diagnosis of these early stage or early symptoms like neuropathy, sensation for heat. There are a lot of indicators which might like help in understanding if those patient is going to have a diabetic foot ulcer. And after this, we are giving the proper footwear, or maybe insoles you have to put inside your shoes. You have to wear at least comfortable shoes, and wearing this insole will be sure that distribute the pressure and relieve the pressure from the place which is under the risk of formation of ulcer.
Yeah.
And after that, if the ulcer happen, that is different story, because we have now to treat the ulcer and to prevent this from happening again. But at the end, yes, symptoms are there. You stop. Your sensation in your foot will goes down. I don't want to say it's called diabetic neuropathy, but this is a medical term.
Yeah.
I could say here it is a loss of sensation. It will not be like before.
It's good that you are speaking in a layman's tongue so that everybody will understand.
Yes, this is why I'm trying to explain to everyone that this is one of the stages of diabetic foot.
So can someone self-diagnose?
Can what?
Somebody self-diagnose, like me, if I'm not a doctor. Yeah.
Yes. And I'm telling you, I think with the new AI technologies and the new wearables, and I think the technology of diabetic foot is going to test yourself at home.
Yeah.
So like you could have a thermometer. You can know the temperature of your feet, right? There is you could know sensation. Even there's some devices with working with vibration, or maybe there's a monofilament, is a simple like a plastic like device.
Yeah.
You put it in the tip of your tubes. You understand if you feel, and there's some digital. I think with the new science coming on the way, majority of the people will be able to make self-diagnosis in home because especially feet, you don't need to have sophisticated devices or something. It's just a temperature and sensation, which you can measure it easily.
And Rothana is providing the means, like they're providing the devices to make it.
We have all type of product which is doing diagnosis, different products and prevention, and also treatment. This is what we are doing. As I said to you, it's 360 solutions. We are not selling products. This is a solution. We are managing the diabetic foot complication, not only selling some product for certain disease or certain symptoms. This is a full solutions, and this solution actually is matching the guidelines of diabetic foot.
Yeah. And I see that you are expanding. You are expanding into European markets. Particularly, you started with Spain. So I want to understand, because I will also ask you about my continent, that is Africa. So I want to understand what inspired this move in going into a European market.
It's very, very good question. But let me tell you something. Expansion for me is not about the companies growing. It's an impact. We wanted to take this impact to different market. Do you think like people in Europe does not have diabetic food? They have diabetic food.
Yeah.
So it's the solutions we are doing or we are offering, which 360 solution, is also needed in Europe. So I think the mission for us is not only to treat people or to manage diabetic food within the Middle East and Africa. We also wanted to take our solutions and bring it to Europe, because even in some countries, Europe, we still have the gap. We believe that we need to make our impact in the even in in Europe and everywhere worldwide. So as I said, we don't sell product. We are here saving life and giving solutions. And I think Europe also will be some patient in Europe could be get benefit from our solutions. This is number one. Number two, Spain is, for us, is very interesting country. It's also connected to a little bit about Africa. You know this already, part of Africa, and also like in the exportation of Africa. We can use it to like expand our business into Europe also, UK, France, Germany, whatever the countries in Europe.
Yeah.
And in the same time, although Europe is a very challenging place because the regulation is different, like the market totally is different.
Yeah.
But again, I don't want to say that we are going there to compete. We decided to go to Europe because we wanted to spread the awareness. So like giving our solutions or offering our solutions, 360 solution of diabetic food to every patient. And I think this is very important. And in the same time, don't forget that Europe is the land of innovation. They have a lot of researchers. They have a lot of new technology. We are not there only to offer our solutions, but also to take the most updated solutions, especially in UK, let's say, for diabetic food, and bring it here to Middle East and Africa. So it's a two-way. We're trying to serve those patients in Europe with our solutions, and in the same time, we're trying to export the technology and bringing the technology, or let's say import the technology from Europe to Middle East and Africa, which is very important.
Yeah.
We need to be very close to the researches, innovations, new products. When you are operating there, you will be connected more and you have access more to those solutions, which could also benefit our business, and also will spread like those technology will be able to, we can bring it here in Middle East and Africa more faster.
You said that you're not going into Europe market to compete, but I want to ask, is competition is not going to push you to improve your products, the efficiency, how fast your products come into market?
No, but I think maybe you understand my comment in a different way.
Yeah.
I'm not saying that we cannot be. Okay, competition is a very important aspect of business.
Yeah.
But I'm not. I didn't say we are not going to compete. It means that my interest is not just to take my product and make some money.
Okay.
So I'm not competing to make more money, or like I have a mission.
Okay.
My mission is to save life. And I can see that because we don't cover Europe before, or even USA, and which I'm sure that we'll do this in the future. I think we are creating an impact. This is the meaning of my words. It's not to compete in just selling a product. We wanted to create our impact, which we are doing here in Middle East and Europe also. So it's about leaving the impression, and we wanted to make a new level of managing of diabetic food and wound care in a different way. Because I will tell you something. Majority of the companies are just selling. You call them in the phone, they say we have this product and that product. We always in all our material, when I speak about what Rothana is giving to the market, I don't like to say I have this product. I like to say we are offering solutions for those patients who are suffering from diabetic foot complications. So I think I'm going there to make the same impact. But sure, I will compete with people.
Yeah, okay.
But my concept is different.
Yeah, I asked you that. Why I asked you that question is because here in Dubai or here in the Middle East, your company is recognized because of their solutions and what they are bringing to the market and how they are saving lives here. So that is why I asked you that questions. so that other people will understand the thing your company have achieved here in the Middle East is also what you want to take to European markets.
Yes, agree.
And that is what is taking me to my continent in Africa. Africa represents, will I say, challenges, at the same time opportunities in healthcare industry. So I want to ask you, what is the Rothana plan? Do Rothana have any plan to expand into Africa, and how do they plan to go about it?
Okay, I'm from Africa, so
Yeah.
you know that I'm from Egypt. This is my home country, and the issue in Africa that it's a land of opportunity, but at the same time there's a lot of challenges in Africa. And before we start talking about what we are planning for Africa in 2025 coming on, because actually I think Africa for me is my major mission. So
Okay.
if I wanted to save lives, I have to go there and create the impact, which we talk about in diabetic food.
Yeah.
And let's talk about some numbers, just for your information. There's around 24 million person in Africa who have diabetic food. And
Diabetic food?
diabetes, sorry. I'm
Okay.
sorry.
Okay.
Diabetes. And you know that this number is subjected to be 130 times percentage more within the coming 2020, 2045. It will be something around 55 million of people.
It's going to increase.
Yes, a lot. The percentage of increase is very huge also. And what is very shocking that I have to tell you that 50% of the patient in Africa is not diagnosed.
Sorry.
They don't know.
Sorry. You said 24 million.
Yes.
Correct now, that's the number.
Yes.
And from now to 2045,
yes,
it's going to increase to
55 million.
That is 100% increment.
More, 130%.
It's crazy.
Yes. Not only this, listen, this is a very important point here or information, that 50% of the patient does not know they have diabetes. There's no diagnosis. They don't know they have diabetes. This is very shocking.
Yeah.
That they are diabetic, but they don't know.
But they don't know.
This is number one. Number two, like I'm sorry, but this is like, it's coming from the WHO. I have some reference for this. But every two children who have type 1 diabetes, one of them only can have the insulin, the other one cannot have.
Sorry?
Every two children, young children,
yeah,
who have type 1 diabetes, they wanted insulin, right? This is a treatment. Only one can have the insulin, the other one cannot.
Why?
There is no limitation of the treatment. Limitation of the treatment.
In Africa?
Yes.
Okay.
This is the published figures. I can show you the reference if you want. You understand the impact of this on patient? People does not know they have diabetes. Other people, they don't have access to the treatment, basic treatment, which is insulin to treat diabetes, high blood sugar.
Okay.
Not existing. If we go to diabetic food, this is different story. I'm talking to you about basics. So there is a missing of infrastructures. There are missing of education. They're missing of the tools. They're missing of medicines. It's a shortage for everywhere. So I think this is the place we have to go there and make our own impact. If really we wanted to save life of patients, we have to work for Africa. So if you ask me, where is Africa in your plan? It's everything in my plan.
Yeah, what are the means to get the message across? What are the means, like what people to talk to? Is it doctors? Is it hospital owners? Government?
Okay, I will tell you something. If we wanted to make a right plan for Africa, which I think this is a correct plan, number one, we have to start making awareness and educational program to both patients, communities, healthcare providers, government, everyone, doctors, nurses. Correct?
Yeah.
Because this is number two. We have to find affordable solutions. Because let's say if some people saying I wanted to be like, if I talk about my business or my mission solutions, I wanted to diagnose, prevent, and treat diabetic food. Okay, I should find like affordable solutions. It means that I should diagnose with not like a device with a very high expensive. If they cannot afford it, they will never do it. But I'm telling you that what Rothana is doing, that we are digging everywhere in all the industry, factories, everywhere worldwide, to try to find affordable solution. And then I'm telling you and confirming in this podcast that we could diagnose, prevent, and treat diabetic food with non-expensive product. And this is a knowledge which I wanted to spread in Africa. or this is the awareness I wanted to talk about.
Mm.
That you don't need to spend a lot of money in order to prevent, diagnose, or treat diabetic foot, because maybe they understand that I don't have the money, so I will not go for this area. No, it's affordable. Like monofilament, which is a simple tool to diagnose diabetic foot, you can buy it at $5, $10. I don't think this is expensive. I'm not talking here about hundreds, thousands of dollars to diagnose the patient. So easy. And when monofilament can be used for multiple patients, because it's like you're just checking the sensation of the tooth tip. Why we don't make diagnosis for diabetic foot? At least screening. And I forget to say, missing of data.
Yeah.
You might not in Africa. You might in some countries. You don't know what is aesthetics. You don't know what is how many people. What is a patient, because there's no data to start even screening the patient.
I was even about to say that, because from now to 2045, that's about 20 years time.
Yes.
That means in 2 years you're having like 3 million patients with diabetic foot, right?
We're talking about 30 million, not 3 million. From 24 to 55.
Yeah.
30 million.
That is like how many years to come? That's 20 years, right?
Yes.
That's 20 years.
Yes.
I'm trying to calculate in 1 year, because that's a staggering speed.
But like, okay, if you can calculate in 1 year, if divide this number, you'll find that every year you'll have around 1.5 million.
That's a staggering
Multiply
speed.
by 30, it will be 30.
And African population is also increasing.
Everywhere it is increasing.
If I'm counting from my own country right now, in the next 20 years, I think Nigeria should be around 300 million. That's the number.
You mentioned Nigeria. We are one of the countries we'll be starting doing this is Nigeria, because of population big.
Yeah, I mentioned Nigeria because I'm from Nigeria.
Yeah.
So it's a staggering speed. The way the numbers are growing is crazy.
Yes.
And it's good that we are into social media, because we have to spread the news for people on authority or people that are supposed to take this word further to take it further, right? So my next question will be like, in today's world with social media, everything is going online now. So I want to ask you, what is your strategy? What strategy do you think is credible to build it? Or what strategy do you think one should take to build a credible influence on today's digital world?
It's digital media is like, this digital media is very crazy, to be honest, and everyone to want to be every day in social media. But in my point of view, that you don't need to be important. Like I'm showing myself. I think you should be valuable.
Okay.
So I think people will follow leaders who add value to their lives. They may change, impacting them, inspiring them to do positive change in their lives. They will give them information maybe to change something they're doing wrong. And this is very important, because we don't need to show that we are important. I think we should focus more to be valuable to our audience or everybody in social media. This is number one. And the strategy should be like, I should be like real person. Like, people who like using script, like a perfect script, and showing that everything is perfect in life. I think people coming to social media to see the real people, that you should see the failures, the wins, the bad, the good, because they wanted to learn from you. Not only like showing that you are perfect all the times. This is very important. So I think you should be the real person who you are. You should show all the good moments, the bad moments, all the failures and wins. At least people will start to see your reality, because people will learn from your experience. And the experience should be having both sides. This is very important. Number two, you should be consistent. Like you cannot show up in one day putting post and then you disappear for like 10 days or maybe 1 month, and coming again and expecting that people will follow you. I think person should be having a mission and should work for this mission. You should communicate, reply, comment, share thoughts, giving informations. This is very important.
Yeah.
You should also in my mind a lot of things, but I think you should also don't stop learning, because if at that point you understand that you have all the knowledge, you lose your audience, you lose everybody in social media. I think you should learn. You should learn from others. You should learn from experts. It's not bad things that I have to cooperate with somebody who's expert in this place, like in science. Let's say I cooperate with a big doctor on diabetic food. I think majority of my post and education which give to patient is I bring it from doctors, and even I put the names of people who I follow and who I draft my post from, because I have to refer. Those are the leaders and the expert in this diabetic food and wound care, and those who everybody worldwide should learn from them. So this is very important. Also, you should accept criticizing. That people, you should change your content if somebody is commenting on it. Okay. So I think you should be interactive with the people over social media.
Yeah.
This is very, very important. And I think in social media, people will follow, it's very simple things. Sorry, but very simple things. I think I will not feel that I have done my mission unless I see what is the positive impact I have done to those people who is following me or watching me anywhere.
Yeah.
You should see people have done changes, and this is your impact, not being like coming every day on social media or being famous, but the acts we do and what is the impact of these acts or whatever post or information on the people, like saving life, improving quality of life for me, like changing people, making person living more better life. I will be happy. So I should see my impact, because people will follow people who will be working to change their lives, making impact on their lives, adding value to their lives, helping them taking positive decisions, either in business, personal growth, health. I think this is how social media should be. It's how we impacting or make an impact on people's life.
But social media, to grow your influence or to get yourself known, is not also an easy task.
Yes, agree.
So you have to come there, and you have to dish out value, most importantly, and you have to be consistent.
Yes.
But when someone tries like people trying, but still they are not growing, what should they do? First, they have to have love for that, right? And they have to make sure that the content they are creating is valuable and is impactful to people.
Yes, I agree.
Yeah. So, okay, I would like to know, because corporation plays a big role in long-term goals. And right now, today is, I think today is 3rd January, right? We're already in January.
Happy New Year. Huh?
Yeah, 2025. So I want to ask, what corporations do Rothana plan to work for, or what kind of partnership are you planning to go into to achieve your goal?
Actually, thank you for raising this point. And I believe that cooperation is a pipeline who is like bringing you to the innovation, because we are always wanted to give updated solutions for those patients, because in my business or my area which I work in, that we're working always to save lives, and save lives needs always to be updated with new technology, innovations, and cooperation is your backbone into bringing those new technologies into the market.
Yeah.
And actually, Rothana is like in 2028, like late 2024, we have decided not only to be, even we are not selling product, we are giving solutions to those patients, but we have decided to play more role. We wanted to make our impact more better, more bigger. That we decided to be a hub of healthcare technology. And this is, to be honest, it's very hard, and very tough mission. I think I put myself and my team in a very big challenge, because we wanted to always bring those new technologies about healthcare, and this is, I added already longevity, diabetic food, aging, diabetes, to those people in Middle East and Africa, and try to spread awareness, making great impact to the market. And to be honest, if you won't ask me, I wanted to make impact worldwide, not only into the Middle East, because I'm sure that there's a patient in some places they need this education, they need this awareness, and this is why we have decided we are going into 3 levels of cooperation. One of the cooperation I think I have published on my LinkedIn lately, which is that we signed a cooperation agreement with Deep Knowledge Group. It's a very prestigious company. And they are working mainly for AI, longevity. They have a lot of platform. One of them is non-profitable. And the other one is they have a lot of companies. I cannot. The numbers is very big. I think they have more than 15 to 16, 20 divisions with different impacting different aspects of longevity, aging. I think with those type of AI and technology they are offering, and they offering partnership worldwide. They offering different products, different even data analysis, which help you to get better results. I think with this big corporation, I think we could create a new way of awareness, even diagnose, prevention, and treatment, and even longevity solutions that we can transfer to the markets, either to the community, public, government level, private sectors, distributors. We want it all to work with this type of new technology to improve the quality and the impact, or let's say creating a new benchmark for healthcare technology. This is number one. We are also we signed cooperation with one company in USA. They will be our partners in digging. You understand? Every time we know about any technology which have come to the market, or
in digging, finding out.
Yes, finding out where is those solution and technology companies. We will go and meet them, discuss with them, getting them permissions to speak about the science, because we wanted to be able to know that there is new solutions is coming out to the market, and it will change the way we treat something, or to prevent something, or diagnose diseases. And this will be very important, because the more knowledge you know about how you diagnose, treat, and prevent, the more outcome you could get.
That's a research company.
Yes.
Okay.
So we are researching, we are connecting to those technology companies, we are convincing them to give us the permission to talk about the science and to talk about the solutions. And not only this, we are trying to convince them to make the solution available in our Middle East and Africa, not only within USA or within Europe.
Yeah.
See, so if any distributor, any type of like private sector, even government, is interesting to use this technology or to bring those technology for those patients, we will be the point of communication and helping them to bring those technology from those countries or from those companies, and to be available in the Middle East and Africa. We want it to be updated of everything. And I'm telling you, there's some countries that is updated on everything in Middle East and Africa, but I wanted here to go to countries which they don't have the resources. They don't have the education. Because listen to me, it's not always about the product. We might bring even solution which is education, knowledge, information.
Yeah.
Because I think information and knowledge is more important than even the product itself. Because when you know, you will act in different way, and the result will be different. So the Rothana is in 2025. We are signing agreement in a different perspective. AI technologies, longevity, biological products, stem cell therapies. We wanted to bring all these new technologies. Diagnosis, AI diagnosis might be just an application in your mobile, by the way. There's some new applications in your mobile which will help you to diagnose better. Even assessing the wounds, taking pictures. There's some devices which is like thermographic device which can check your like blood supply or pressure points through heat. So all these things might be a simple technology. It's not expensive, but in the same time, it's an adding value to what we have now in the market, and it will create great impact into diagnosis, prevention, treatment. So Rothana Hub is a point of contact between those technology companies and the market. This is what we are doing in 2025.
Yeah, as you mentioned Nigeria, and I also remember that what will be the best way, maybe a doctor wanted to contact you, for instance, what would be the best way? Because I think educating these people is better. And there is something we call a town hall meeting, or doctors hosting town hall meeting to educate their clients, or maybe they have a client that has a diabetes, right? It will be maybe word to word, one-on-one education. Just, okay, there is this thing that is going on, just, how would be the best way to reach you? If there is any doctor that comes across this video and wants to get across to you.
Okay, and maybe some people will not believe me, but I'm available 24/7 for anyone, and I'm not joking about this.
Okay.
So if somebody send me a message, especially when you talk about something which is impacting patients, saving lives, I'm available anytime. You can send me on my LinkedIn account. All my WhatsApp numbers is published. My email is published online. I don't hide my contact details.
No,
It's already everywhere.
I asked you this question because you're a CEO. Most CEOs is unreachable. So if someone sends you a message, you are the one that will receive it.
Yes, but I would like to tell you something. Maybe I have like I disagree, but all the leaders who's having a missions, whatever the industry you work in, believe me, they will always be available. This is like basic things. So leaders who are not available, I don't think great leaders who are always working for population to serve people, whatever the type of business they're working in or the services they are giving to the population, they will always be available. I'm the person who's replying to anyone. If you send me a message on social media, on LinkedIn, I will be the one who reply to you. On WhatsApp, I will be the one who reply to you. Whatever on email, I will be the one who is replying to you. I don't have anybody who's drafting for me messages or reply or managing my social media, and I will never do this. Even if I have 1 million followers, I will keep either I will be not I will mention to the people that because I cannot reply, but I will be always transparent in giving the informations to the people who are contacting me. And the time being, I'm the person who is contacting people in all my social medias and all my numbers, either call, email, or WhatsApp. So they can contact me anytime. My contact is already published in LinkedIn.
It's handled by you.
Yes.
Is it because of UAE environment, how the environment is, the provision the UAE has made? You know, UAE is referred as a land of opportunity. So the question I want to ask you is, as UAE is, because of the provision UAE has made and how it is referred as land of opportunity, the growth and the innovators, everything that is available here in UAE, I want to know how UAE has influenced Rothana on their success.
And then thank you for asking this question, because actually I have to admit that I don't think UAE is a place of where is my company exists. Okay. I think UAE is an innovation center for anybody who wanted to create or open any company worldwide. And I don't take it as a location. It's a point of growth that we exist here in this. Like, we are very lucky to be here in UAE. I don't want to. I cannot say a lot of things is happening here. You're talking about stable economy, security. They are the initiator of the innovation. We are not a very competitive market. I always say that the customer in UAE is always used to the premium level of services. So you cannot do something in the middle. You have to, even from the government, they are the niche of innovation, and they are the leaders of for everything, like the perfect services. So you are not only competing with you're only trying to be as equal as what is the government itself is providing to the population. So which is very hard. In other countries, you might not find something like this. So they are always the point or the initiator of everything which is innovative, successful. Also, you are talking about a country which have more than 220 nationalities. Do you understand what is you have a small universe in UAE? So I'm very like blessed to be here in UAE, to start my company here, because I have learned a lot of things: how to make the best services, how to make the premium services, how to look for innovation, because we are talking about Rothana hub of technology. Yes. This country is already the hub of technology. Either it's the space science, AI, the research in all type of different business sectors, science. So you are already living in a place which is the point of innovation and growth and premium services, competitive market. So you should at least try to do your best to be within equal level. I think the leaders in UAE have have created something which is hard to be created in different place. So I think I wanted to be to make Rothana also we impacting worldwide everywhere from UAE. So the UAE is a point which we could really impact others or inspire others, because this is really what the leaders and the people in UAE are doing everywhere, every day. They're inspiring us to do everything in the best way.
Will you say is this environment that made you to keep your contacts open, like you are, how open you are for people to always get to you? Is it environment or this is who you are?
No, it's both.
Both.
Yes, it's both. But I have been raised in a way which is I wanted to be always available to help people. This is part of my like childhood raising. So
Yeah.
my family have put in me like a principles, or like let's say an idea that you should always dedicate part of your life to help others, and this is what makes me happy more than anything, even the money, than success. I would be very happy if I make any help or any impact, positive impact to any person life, whatever the way, in health, in business, inspiring them. It's something makes me like feel the energy that I wanted to continue. This is the mission which I'm living for.
Mm. Okay, this I am very interested in longevity and expanding lifestyle and lifespan, longevity and lifespan, and I would like to invite you more again, so that we'll talk specifically on longevity and lifespan. Is that something you are open to?
Yes, I'm very happy, because to be honest, longevity sometimes it's connecting people more than diabetic food, because diabetic food is just like only maybe it's a part of complication which only will be interested into those diabetic patients. But longevity, if everybody living, starting from the people which is young age, maybe 20, up to the old people like 70 and 80, everybody wanted to know how can they live healthier. Because I don't want to always to have the fight of if the longevity is living more or living better. But I believe now with the science we have now, let us focus on how we can live healthier, not live longer, because this is more important to me.
Yeah. Somebody that watched our episode now, how long can they expect us speaking about the longevity? How long could that happen? After this podcast?
Yeah, I understand you.
Yeah.
I'm available anytime. You can call me and we can come and we can talk. We can make series of podcast about longevity. But I won't like always to put myself in from the industry level. I'm an industry expert.
And on your page, there is something you said there about deep knowledge. I will also, on that time you explain.
Deep knowledge is very important. Companies, you have a lot of platforms. And I starting from, I think maybe today night, you'll start seeing posts explaining or giving information more about deep knowledge and what they are doing, because it's a very great company.
I opened the website to get insight. It's very complex.
Yes.
I hope you will explain it more when you come. Yeah.
I think when you see the system of deep knowledge, you think like we are in a movie or something. Like everything looks like artificial intelligence, they have a very very solid system.
Okay.
I think I still need time even to learn the system more, but they have very solid system.
It was a bit confusing for me. So
yes.
So doctor, what legacy would you like to leave, and your message for young leaders?
This is very very good question. Also, I would always wanted people to remember me that I work and die for creating an impact, making positive change for people's life, and save lives for those patients who are suffering from diabetic foot. This is the most important legacy I wanted to leave. I don't want to be not being famous, not being rich, but being a person who have dedicated his life to try to make a positive impact to save other people's life. This is this is the main message. I don't have any other to say, to be honest. And for those leaders, I wanted to be people, please do not have any fear from failing, because failing is the point of success. Always surround yourself by people who supporting you. This is very very important. Family, colleagues, your father, your daughter, your wife. So I think you should be surrounded by people who support you, because sometimes at hard times sometimes we lose hope. Everybody have a point which he might lose hope. And those people who stand behind him and supporting him is the point of faith. So I think you should be always surrounding yourself by people who support you. Resistance. You should fight.
Yeah.
You should beat the challenges. You should have always every day new, I don't know, new aim, something you wanted to achieve, and even if you achieve it, put another one. Don't stop putting challenge in your life. This is the most important things. And the most important thing, and the last thing I want to say, for me, like sometimes think money is a success. Like I think being successful means that I think you should be happy about what you're doing. You should believe in what you're doing. And I believe in myself that knowledge is the ultimate power, not the money, not anything. So always update yourself, read every day, back your mind with a new knowledge and things which you don't know about, because this is your credit and this is what will show your value. Always try to make the information simple to people, like because if we will keep talking medically and like with a very complicated term, people will not will stop watching us. I wanted people and who have missions to think about those guys who even hardly they don't know. Maybe some people does not know how to read in Africa, right? I wanted to make my message simple because I wanted to reach to this guy and putting an impact in his life, making positive change. So be simple, be like very, very close to the people.
Yeah.
And this is the moment.
Okay. So I want to say something to my audience before we close this section, because I would like them to comment exactly their takeaway from this podcast. I would like you to comment your takeaway and any questions you have on this podcast. Comment, please, so I will relate it to him and he will answer you either on our next podcast or I will put it on the comment section. Whichever way you want it, comment and write whichever way you want it there. My own takeaway, I think I have failed enough. You say, don't be scared of failing.
Yes.
Because you learn from failing. I think I have failed enough. And inviting high level professionals on my podcast, I am also learning from them. And I'm hoping that you are tuning in on every of the podcasts to learn and take something away from it, because I am sure that I have failed enough. You cannot be meeting these people every week and continue to fail. It's basically impossible. So share this video. It's very important to go wide and far, especially everybody watching this from Africa. I said especially, maybe Nigeria, but especially everybody watching this video from Africa. It's essential that you share this video. For people, maybe doctors, hospital owners, people on authority need to see this video so that they do things that they are supposed to do. Like you heard from him, there are no data of diabetes in Africa. None. The data is missing. So we don't know exactly the number, but from World Health Organization, right?
No, there is some data, but the data is not enough.
Yeah.
To let us understand the real situation. So missing of the detailed data.
Yes.
Because there is data. If you go to check a website and you will find some studies happening and prevalence of diabetes, and WHO, they also publishing some data. But at the end, the missing of the detailed data, because when the more information you know, the more it will help you to plan the correct actions.
Yes.
So I think we should seek to create those data, and this is one of the things with deep knowledge and doing. By the way, they have data analysis platform, which I think we should. I hope we could support Africa with this platform.
So, and there are people that has this diabetic foot wound in Africa and they don't know. So there are no checking. Nobody knows exactly what it is that is going on with them now. So I think this video needs to go far and wide. And thank you for tuning in. Dr. Ahmed, it has been an honor.
Thank you very much.
Impressive.
I'm very happy to be here with you.
Here.
Really. I'm very happy to be here with you. Thank you for everybody watching us.
Yeah.
I hope the podcast have created a positive impact. I hope we could inspire some people to change their lives and making better quality of life. This is what I want. I'm living for. This is my main missions. And thank you for having me today.
Thank you very much for being on.
Thank you.
Guys, we'll continue to bring people at the highest level so that you can get the right information from them. This is the CEO and founder of Rothana. Is a diabetic food company. They specialize in longevity, just like he's saying, diabetic food care and wound management. Please, it's very important that this video need to go viral for people that are in charge to see. See you on the next video. Thank you.